Representative Diana Harshbarger from the great state of Tennessee. She's also a pharmacist, so she kind of knows what she's talking about. Congresswoman, thank you so much for joining us. Appreciate your time today. And thank you for pushing to recognize natural immunity as a real thing. I mean, it's what I always thought, that with every other virus, whether it's chickenpox or anything else, we always recognize natural immunity. So what makes it so different with coronavirus?
Well, Dana, it's a pleasure to be on here. I'll tell you what it is. It's really not about COVID. It's about control. And if you look at what the CDC, just like you mentioned, measles, chickenpox, they accept natural immunity for those disease states because they've been around and we've eradicated those. But for whatever reason, they will not accept natural immunity in patients who have already been exposed to COVID and had COVID. And it's a travesty because we have numerous peer-reviewed articles that show that this immunity, once you've had COVID, is much better than getting 2 shots of the vaccine. And it's real. You know, even Italy is accepting evidence. You know, they're looking for negative COVID tests to travel. They're looking for vaccination, and they're also accepting natural acquired immunity if you have been exposed to COVID. So they're accepting that in order to travel. So why can we not do it here in the United States?
Yeah, that's a great point. I mean, I have friends who are dealing with this, whether at their workplaces and they've already had coronavirus, but they're told that their natural immunity, they still have to get the injection or even to travel elsewhere. I mean, it's still the same thing. I look at NBA players like Jonathan Isaac and how he's not even allowed to eat with Orlando Magic, the rest of his team. He had coronavirus, so he has natural immunity. But we're not, now it's like it's superstition and not science, which of course, it amazes me that none of these health officials, Congresswoman, that are telling us to follow the science, they're not, and that drives hesitancy, and they don't seem to see that.
Yeah. You know, first of all, it was an emergency use authorization, and so a lot of people were fearful. They say these drug companies have, there's no liability associated with them if something happens and they take the vaccine. What if, God forbid, if they die, their family's not taken care of? That was one of the issues. Now we have the FDA approval on these drugs, but there's still hesitancy. When you tell the American public that they have to do something, that's when they're going to say, no, you're not going to tell me what to do. They're stomping on their individual rights and their civil liberties. It's unconstitutional what they're doing with an executive order. And they're getting OSHA to carry that out. They haven't even written the terms of the agreement yet. So that was a question today in one of our conferences. What's the rule that OSHA is going to enforce? We don't know. So here you have these companies in limbo. Look, we already have a labor shortage. We are pathetically in need of nurses and physicians right now. When you look at 50,000 more healthcare workers that will walk off the job, look what happened in New York. They had to get the National Guard to come in and replace those healthcare workers. It's going to be bad. And, talking to the Border Patrol, they're going to lose 20% more of their Border Patrol agents when this goes into effect. 45% of police forces in some of these cities that are already riddled by crime. For God's sakes, listen to us. Accept naturally acquired immunity. It's real, it's effective, it's long lasting, and it's durable. Why not just accept it?
Yeah, and Congresswoman as well, I mean, the injection doesn't necessarily mean that it transfers any kind of immunity. We were hearing from CDC Director Rochelle Walensky herself. She was saying that, well, it doesn't actually prevent transmission. And in some instances, there have been a number of hospitalizations from these breakthrough cases. So how are they mandating that if it doesn't do what they're stating that it's supposed to do?
Well, you have to remember the vaccine can spur these variants. I've just got an Israeli study, and they have 2.5 million people in the healthcare system over there. And honestly, say you got the vaccination in January or February, come June, July, or August, do you know that you were 6 to 13 times more likely to become infected with the COVID virus because you are vaccinated versus unvaccinated that have had COVID already? So there's your sign. I mean, that's truth. And they need to look at that because those, like I said, the vaccine itself can spur the variants. And we've seen it already. We have people who have had 2 shots of COVID. I mean, 2 shots of the vaccine that are contracting COVID and being hospitalized. So, you know, just follow the science, for God's sakes. I don't even know why anybody even still listens to Dr. Fauci.